Good evening, everybody. We have with us this young lady, Sumaya. Welcome, Sumaya. We will do a face enhancement with injectables using Galderma Restylane products. And we will start with the assessment of this face. So the first thing that we can see directly that here, the balance between the nose and the chin. We have a small heterogeneity here, and we can add a little bit more volume to work on the profile of this lady. So the chin will require a Nasha technology. We discussed about that before. I used to use Nasha technology directly on the bone. It works like an implant, and you can reshape it even with your fingers. I use the same Nasha technology. Actually, I'm talking about the lift for the nose also. Every nose job I'm doing actually is using the lift only. So this is my approach. Why the lift? Lift has a different G prime when we can consider all the other products of Restylane. Comparing to Restylane, the lift may give more consistency and may reshape the nose as well as the whole profile.
So I'm gonna use the lift for the chin, and I'm gonna also use it here to redraw the light lines. What are the light lines or sheen lines? The light lines are the lines coming from the eyebrows
till the tip and separate tip. Here we can see that the bony part of the nose is stopping here, and you see that the triangular cartilage have a small what you can see have here, and we're gonna put some lift in that place. The nose is basically good. There is a small hump here. We don't need to inject too much the radix. This is the radix. If we inject a little too much, we will change the angle, and it's not the aim. And we will give her like a Greek male nose, which is absolutely not the aim. So we will keep her female features, and we will try to use just few cc's of lift, especially in the mid third of the separate tip and this part of the nose. I'm gonna also use 0.2 here directly to the spine in order to change a little bit the nasolabial angle. So working on the axis, we're gonna work on the nose and on the chin to have a nice profile and change the profile. We can use 1 ml or 1.5, we'll see. And then what we have to do also, we will try to make the mandibular contour more obvious. Usually people, when they have a small heterogeneity like this, the transition between the neck and the face is not really clear. So the idea is to redefine this contour using, of course, the Define. The Define is the OBT technology, and it's one of my favorite choices for this part of the face. So the mandibular angle is here, you can touch it here. And here we have the marginal and the symphysis part. So I may use 2 Define for that. What we can do also, we can use a skin booster for help. Skin boosters will enhance the quality of the skin. You'll not see it right now, but after a few days, the result will be wonderful. I don't need really much more volume here. She already have some volume in this part of the face. So what I can also do is just few injections in the malar area following the zygomatic arch, just to restore the bony shape of the upper part of the face. So this is it. So we're going to combine OBT and Asha technology for this face. And the idea is to make it more smooth, more handsome. She's already handsome, but we're going to make it better. Okay, let's start. So the first thing to do is to put an antiseptic solution. Transparent one is good. You can use chlorhexidine, or you can use Amkina or something like that. Why I delayed all my marks? Because I know exactly what I'm gonna do, inject. So honestly, I don't need them a lot. So I'm gonna start with the chin. Usually when I start with the chin, I use 3 points. So, and you have to adapt, this is not a rule. Every chin is different. So here we have like 5 centimeters, and we're gonna work on the whole 5 centimeters. So we'll start with the midline. So the midline here, you see the ventrum, and the midline is over here. So I aspirate, and I stay like a few seconds. So there's no blood coming here, so I can inject, and I'll go directly. I don't really calculate. The idea is to see. It's live injection. And when you see the product is coming directly to the skin, you stop it. It's okay. So here I injected 0.2 for the first spot. You okay? Parfait. So as I told you, each chin is different. Sometimes we have small, big chins, and here we will have to work on the whole chin to avoid this Nefertiti, very Nefertiti effect. The V-liner. Go directly to the bone, same thing. Aspirate. So 0.2 again. It's absolutely not painful. And I'll ask you to just, yes. And I'll go here, again, directly to the bone. I aspirate, stay a few seconds, and I will inject also 0.2. So these are my 3 spots. And then I'll come back to see if it's good. It's already good. You can see we're fine. Start to be better with 0.6, but it needs a little bit more. Okay? So we'll finish the syringe on the chin. And what I will need here I will need one more spot here and maybe two more here. So I'll go back to this place and I'll give a little bit more projection. I aspirate. Not a blood drop. Here 0.1, it's enough, huh? Because I've seen it. Yes, that's better. And I'll finish 0.1, 0.1. Directly to the bone. I aspirate. This is my 0.1 here. Now do exactly the same. Excuse me, a little bit like that. Here. So you see, you adapt your spots, your injections, dependent on the anatomy of the chin. And the idea is to stay always, to have nice results, smooth and nice results. And directly we see the difference here. It's nice. And now I'll finish my 0.1 exactly here, what I need. This is well projected, so I don't need to put an injection like this. Usually I add also an injection perpendicular like this. So I don't need it because the projection of this point is good. So I'll need a little bit more projection in that part. It's really in the midline. It's above my first spot and it's going like this. And I'll finish my 0.1 here. That's it. Can you see the difference? We'll continue the injection with the nose injection. So we will inject a little bit, but a few drops only. The radix, the idea is not to give her a male nose. We have to keep her female features. The radix is very good, so that we will correct this hump by injecting before and after the hump. And this part is the bony part of the nose. We have to always to be just careful about a vein that will communicate between the right and the left venous drainage system. So I'm going through the process and I'm going right down to the bone directly. I will start with the midline, and as I told you, you can do with your finger like that and go directly to the bone. What I'm doing like that, and I'll take the soft tissues above. Again, the same thing, huh? I'll aspirate, we'll stay a few seconds. This is wonderful with the Nasha technology. It's magic because you can do it and you will have a negative pressure and no drop is coming. And then I'll inject a few, just a few cc's. So I use the lift for that. Lift is my favorite injectable Galderma product here. I aspirate a little bit. No blood is coming. And then I will go. Remember, really few quantities. Not too much. You see that I stop the product with my two fingers here. I want it just on the midline. I don't want it the products on the right on the left side. So I'm gonna stop it here and I see. That's perfect. I don't need too much, huh? It's 0.05 only. See that with 0.05 you can modulate the radix. For her, we don't need more. Then I work on it. So I will come to the next part of the nose, which is this part. Here we have the tip, the separate tip, and the dorsum. And once the dorsum starts, we have a small hump, which is bone and cartilage both. This part is, we call the plicanasi. It's like an articular ligament between the alar cartilage and the triangular cartilage, and you see a small depression here. So we have to be very, very careful here. Why? Because we have some communication between the arterial systems, the right and the left here. So I'll go through the smash of the nose. Now try to feel my cartilage. It's delicate, but you have to try it. And then I aspirate. And then I inject. Use these, I come, aspirate again, and inject. That's it. Again, 0.05. I'll go step by step. Don't need to put a lot. There's not too much space in the nose, so the idea is to go very, very slowly. And I'll do the same here. Aspirate. And then 0.05 also. I press a little bit for the hemostasis, and then I can modulate the product. So here when the nose is starting to be red, it's not really a danger. It means that you're doing the injections, and the redness, it's not a way to feel danger. But if you see that the tissue start to become white, and then you are invisible or something like that, and you have to inject your remedies. What I'm going to do right now is this transfixion. I aspirate again. I'm under this mass of the nose. Huh? I'm not under the skin. And inject a little bit. That's it. So you see, before modulating, I can see a bump here. before the modulating the product, which is not nice about. Now, because I'm in the right plane, I'm going to do right that. And step by step, well, disappear. Why? Because I'm under this mass and the product may go exactly where exactly when I want. So I still have a small gap here, you see, and a small gap here, but I need more on the right part than the left part. So I'm gonna inject like that. And you see she has a vein, very, very big vein here. So we have to avoid this, up, and I feel the cartilage. So I come down here, and up, that's it. You see the product? I'm gonna modulate it right now. I'm using really very few, 0.4. I just use 0.3 cc. So I worked on the radix, I worked on the transition between the separotip and the dorsum. We have a small swelling here and a blue because there was a vein. And we will finish with the nasolabial angle. So the nasolabial angle, to open the nasolabial angle, you have to feel the spine. I feel the septum. This is my septum cartilage. And the septum is finishing to the spine, and the spine is here. And you have to inject directly into the spine. So what I do usually, I elongate a little bit the lip like that, and I enter at that point. It's gonna hurt a little bit, sorry for that. And I feel my maxilla. I'm on the spine right now. So when you are on the spine, there is no major arteries there. So what I will do, I will aspirate again. Stay a little bit there. Nothing is coming. And I will inject. Slowly. (0.2). Immediate effect. Directly opened the nasolabial angle. So we open the nasolabial angle here. Okay? And I still have the half of the syringe, 0.5. I just work the whole nose with the 0.5. I don't need too much. So we're gonna stop here for the nose. I'm gonna use the half of the syringe. I'm gonna put 0.1 or 0.2 here. We'll see the immediate effect, and then I will calculate how much cc I'm gonna put. So where exactly? So here, you see this is my canthus here, external canthus, and I feel the bone here, and I come like 2 centimeters and the continuation of this arch of the eyebrow. And I feel my bone, and I will go directly like this to the bone. So Nasha technology, I use it for bony approach, and I aspirate again. Nothing is coming. And I'm gonna inject here. .2. I'm gonna massage a little bit. And I give this like, you see, I don't know if you can feel it or see it with the light, but here we have like a continuation here compared to the other. I just put 0.2. Now again, this is my canthus here. I'm going to the bone, 2 centimeters, and I continue my arch here. I feel the bone, and I'm going directly to the bone. I stop here, I aspirate. Nothing is coming, and then I inject my 0.2. And then I massage a little bit. Remember, Nasha technology, you can massage it because it's really wonderful, especially in the deep planes. And this 0.2 may change the light around the eyes and give directly a better bony contour. You see the difference here? The chin is more projected. The nasolabial angle is open. The tip and supratip were redefined, and we have nice slope here. Still a little bit here, but I don't want to inject it more. Otherwise, I'll close the radix. So it's really wonderful. So we injected here the chin. The chin is more projected. Nasolabial angle is more open. The tip and supratip, the double break is restored, and the nice slope here we have it, and we restore it with the face. We restored also the magic dorsal light lines. The artery, the facial artery is coming like that. Okay, so I put my introduction point here. I put my define. I'm going a little bit up. I'm going slowly to avoid a lot of pain. I put my define, and I'm going like a triangle shape to this part. I don't only focus on the mandibular line, but the whole triangle to give the illusion of volume. So I still have like 0.3. I'm gonna use it in this proximal part here. I massage a little bit. This is OBT technology. Also massage a little bit. I see my patient like that. Very good. So I use the same introduction point, and I just change the angle. This is a 22 cannula. You can work with a 25 or 22. For the define, I prefer working with 22, but I go very slowly to avoid any pain. And you feel the ligaments here. And slowly you come back and you inject at the same time. Slowly, slowly. Remember, we injected the lift in the chin. And I inject around the entering point. Few cc's just around the entering point. So you see directly it's more defined here. And you can see the difference. We work on that part and we do not work on that part. And it's totally much redefined, better defined. We just used one syringe. We can use 2 or 3, but with one syringe, we just have already a nice result. So here is my mandibular contour. The artery is here, and I'm going here. Tuck. One entry point. It's very important to feel where is exactly your bone and what to do you have to avoid to be very superficial, and then you will have very ugly contour like that. So the idea is to not too deep and not superficial. Staying above the muscle and the mass, going slowly. And this is the tip of my cannula is here, the angle is here, the tip of my cannula is here. I feel it, and I come across and come, and I feel. What I usually do, never just follow the contour. The idea is to do a triangular shape injection. So I start with the contour, go slowly, don't try to force. Canna will follow by itself. Voilà. And then I change the angle. The cannula going here. And I change again the angle, sorry. You see my triangle is starting to be obvious. It's OBT technology. You can massage a little bit, but not too much. And I need more projection, especially in that part, near this mandibular angle. So I'll go here. This is the tip of my cannula is here. And I inject a little bit slowly, 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 slowly. Again, come back. I need to stop at 0.3, and remember to finish that part. You have to be symmetrical. Go slowly. Feel this mass. You're above it. And then again. And this is it. And I already start to have a little small shape here. Now I'll finish my 0.3 to have a smooth contour between the chin. I injected with the lift with the Nash technology and the OBT technology here to have more defined contour. Now I'll go to switch the position. I'm in, so go very slowly because there is a strong ligament here. So you don't have to break them, it's not the idea, but just, yes, you feel them and you go slowly and you inject a little bit. Different directions. You change all the time a little bit the angle. The idea is to have a smooth contour. You remember you injected here, so we start from here. Tick, tick, tick. And then I will inject this part. And I will do like small. So here we will inject the lips with using the KISS. It's OBT technology. The major problem with the injection of the lips that all the people do the same mistakes. They inject like that. and then you will have step by step the duck lips. So why they inject that? Because it's more easy. It's more safe, but safe can be also performed with using other approaches and techniques. So here we will inject the red lip, and we will invert a little bit the lip here like that. The lower lip is good, but we will make some hyaluronic acid for hydration also. When I will start, I will do like that, small injection and small quantities. She doesn't ask for a lot of volume, huh? She may feel a little bit pain, sorry for that. We are going to be quick. Sorry. See, I'm not injecting the border, but I'm injecting just close to it. And I do very, very few cc's like that. And I do like 2 to 3 passage. You can breathe a little bit. Smile. I like to inject. I tell to my patient to smile and inject this. This will give not much better art. This arch is much better defined when she smiles. You see that we injected like few here, and you see the difference compared to this one. And smile, and I'll inject a little bit here. Yes. And massage. So I injected just 0.4 of kiss. You see, we give more hydration to the lower lip, and we give a little bit more volume version to the upper lip, and it's directly more beautiful. So we use a lift here. It's nanotechnology to redefine the profile for this lady. We injected 1 cc here of lift, and we injected 0.2 here, and really small quantities all over the hamp here, before and after the hamp, and also the tip and the super tip, and also restored the light lines here using 0.5 cc in total, including 0.2 for the spine here, for the nose. What we did with half of the syringe is inject the zygomatic bones here directly, 0.2 and 0.2, and we redefined the nice triangle of the face with the chin. We injected the define to redefine the contour. Now look at her, she's very nice, smooth contour. The mandibular angle is more obvious here, and the transition between the contour and the chin is really smooth and natural, and she looks really gorgeous. And finished with the 0.4 cc only with a kiss. We injected the upper lip just to avert a little bit the red lip, and we injected the lower lip just for more hydration, and the result is gorgeous.